The LUBO Airway Collar is foremost an airway device. With the ability to protect the cervical spine, it's the only non-invasive device that can perform a jaw thrust maneuver on a patient with or without the need for cervical spine immobilization. The LUBO Airway Collar is easy to use by any EMS and hospital professionals, as well as any basic life support trainee. The LUBO Airway Collar is in one piece, adjustable to all adult sizes. Soon a mini LUBO will be launched for all smaller sizes. It's a single use, radiolucent, low cost, and easy to operate, as I will demonstrate for you shortly. The LUBO can be used in both the sitting patient, like in most car accident scenarios, as well as when the patient is laying down in the supine position on his back. Notice that before placement, the mandible holders should be checked for their rear position. There is no need in pre-measurement of the patient's neck and or other adjustments. In order to place the LUBO Airway Collar, just slide it underneath the patient's neck gently. Do not move the patient's head. Search for the mandible with your finger and pull the flaps to the forward position. Use the neck strap with the hook to fasten the chin. Don't remove your fingers until it's fastened. Use the plastic strap and slide it into the slot in order to lock the collar on the upper chest of the patient. Now readjust the strap on the chin. If airway is compromised, pull the levers on the mandible flaps. By pulling them forward, you are performing jaw thrust maneuver. Now the patient can breathe. If advanced airway is needed, release the chin holder slightly and open the patient's mouth. You can insert a laryngoscope inside and perform an intubation or an LMA or combi tube just as well. You can perform all those airways without removing the collar or compromising the patient airway. Once finished with the procedure, just fasten the strap again on the patient's chin. Once it is done, you can check for pulse. You can release the chin holder in order to perform intubation and other advanced airway. You can palpitate for the carotid cartilage and perform a surgical airway. If the patient have regained conscious, it is advised to release the levers backward by inserting your finger into the port at the back of the collar and pulling it back. When using the LUBO Airway Collar on a patient who is sitting upright, make sure to hold on both mandibles with the flaps while tightening it, so that the collar won't push itself back. Then use the chest strap to lock the collar in place. Readjust the neck strap and pull the levers to the forward position to open the airway. Once airway is secured, patient can be transferred into a hospital.